This is a short video on exercise pressure response and what is the mechanism of post-exercise hypotension. To understand this, we have to understand first the baroreceptor reflex. Let us start with increase in BP. When there is an increase in BP, it is sensed by baroreceptors which are present in carotid sinus and aortic arch. The afference from them through 9 and 10 cranial nerves reaches the nucleus tractus solitarius, which is stimulatory. The second order neuron from the NTS has now to go through SVLM, caudal ventrolateral medulla, which gives a negative supply to the RVLM. RVLM is rostral ventrolateral medulla. RVLM is the site of central sympathetic output. When you look at this reflex, central sympathetic output now goes to heart and blood vessels, okay, which helps to increase the heart rate or decrease the heart rate or vasoconstriction or vasorelaxation depending upon the sympathetic output. When there is an increase in BP which stimulates NTS, which will stimulate CVLM, which inhibits RVLM, which is sympathetic output. So the net effect is decrease in sympathetic output, which decreases the heart rate and causes decreased vasoconstriction or vasorelaxation. This will come back to homeostasis to decrease the BP. This is the normal baroreflex. Okay. Now what happens during exercise? During exercise, muscles are stimulated. Okay. It can be mechanical or it can be chemical. Both the stimulus are carried by group 3 and 4 receptors which are present in the muscle and which are carried through the spinosolitary tract through the spinal cord. From there it reaches the nucleus tractus solitarius, but it has a bisynaptic connection to the NTS. The afferent fibers will release substance P which acts on a specific inhibitory interneuron to the NTS, which inhibits the NTS output. Now what happens if you see in exercise, the afference is stimulating the inhibitory interneuron which inhibits the NTS. Now NTS has both the input, positive input from the baroreceptor of increased BP and negative input through the spinosolitary tract from the muscle afferents. The net effect is that now the NTS has to decide between the positive and negative response. During exercise, this negative is more. So what happens? The activity of the CVLM decreases. So the inhibition to the RVLM decreases and the sympathetic output will be increased. So during exercise, there will be increased blood pressure and the baroreceptor reflex will not be properly working, or the baroreceptor setting is set at a higher BP level because of this mechanism. This is called as exercise pressor response. That is why during exercise there is increase in BP and the baroreceptor seems to be not working. Okay, now coming to the mechanism of post-exercise hypotension. This happens because of the continuous activation of this exercise pressure response system. The mechanisms, the substance P which is acting on the inhibitory interneuron through the neurokinin 1 receptors. If there is a continuous activation, there comes the internalization of these receptors in the inhibitory interneuron. So the total number of receptors in this inhibitory neuron will be less after the exercise. So after the exercise, what happens? There will be positive through the baroreceptor reflex, but the negative inhibition from the spinosolitary tract is reduced. So the net effect is increased NTS stimulation. If there is increased NTS stimulation, there will be increased CVLM stimulation and more inhibition for the RVLM, and the sympathetic output will be decreased. That is the main mechanism of post-exercise hypotension because of internalization of neurokinin 1 receptor in the inhibitory neuron of nucleus tractus solitarius. There are various other mechanisms postulated for the post-exercise hypotension, which will have endogenous opioids, serotonin, and angiotensin 2. All these mechanisms will act through RVLM, which is the central nervous system's sympathetic output. So endogenous opioids, serotonin and angiotensin 2 will act through RVLM from other centers to cause post-exercise hypotension.